ADHD, or Attention-Deficit Hyperactivity Disorder, has a long and complex history.
Early descriptions of ADHD-like symptoms date back centuries. Sir Alexander Crichton, a Scottish physician, described similar behavioral patterns in the late 1700s. However, it wasn't until the early 20th century that the condition began to be formally recognized. Initially, it was seen primarily as a disorder affecting children's behavior. Over time, our understanding of ADHD has evolved significantly. We now know that it can persist into adulthood, impacting individuals across the lifespan. Furthermore, research has shed light on the neurological underpinnings of ADHD, moving away from simplistic explanations that blamed parenting or environmental factors. This shift in perspective has been crucial in reducing stigma and promoting empathy for individuals with ADHD. The journey towards understanding ADHD has been marked by both breakthroughs and setbacks. Misconceptions about the condition still exist, highlighting the need for continued research and education. As we delve deeper into the complexities of ADHD, we gain valuable insights that can help us develop more effective treatments and support systems. This ongoing exploration is essential for improving the lives of millions of individuals and families affected by ADHD. ADHD is a neurodevelopmental disorder characterized by persistent patterns of inattention, hyperactivity, and impulsivity. These core symptoms can manifest in various ways and to varying degrees in different individuals. It's crucial to understand that ADHD is not simply a matter of being distractible or energetic. One of the most persistent myths surrounding ADHD is that it's linked to intelligence. This is entirely false. ADHD is a neurobiological condition that affects attention regulation, not cognitive ability. People with ADHD can be just as intelligent as anyone else. In fact, many individuals with ADHD possess unique strengths and talents. The challenge lies in the way their brains process information and regulate impulses. This can lead to difficulties with focus, organization, and emotional control. It's important to recognize that these challenges stem from neurological differences, not a lack of willpower or motivation. Understanding this distinction is crucial for fostering empathy and providing appropriate support for individuals with ADHD. The symptoms of ADHD can impact various aspects of daily life, from work and school to relationships and personal well-being. Inattention might manifest as difficulty staying focused during meetings, losing track of thoughts, or struggling to complete tasks. Hyperactivity can present as restlessness, fidgeting, or excessive talking. Impulsivity can lead to interrupting others, making rash decisions, or struggling with emotional regulation. Imagine trying to read a book while a marching band plays outside your window. This constant barrage of distractions might resemble the internal experience of someone with ADHD. Everyday tasks that others find simple, like organizing a to-do list or sitting through a movie, can feel overwhelming and require a Herculean effort. It's important to note that ADHD symptoms can vary widely from person to person. Some individuals may primarily experience inattention, while others might struggle more with hyperactivity and impulsivity. Furthermore, symptoms can fluctuate throughout the day or in different environments. Recognizing these nuances is essential for understanding the individual experiences of ADHD. ADHD is one of the most common neurodevelopmental disorders, affecting millions of children and adults worldwide. According to the Centers for Disease Control and Prevention, approximately 9.4% of children in the United States have been diagnosed with ADHD. While ADHD is typically diagnosed in childhood, there is growing awareness that it can persist into adulthood, with an estimated prevalence of around 4% in adults. The reasons behind the apparent rise in ADHD diagnoses are complex and multifaceted. Increased awareness and improved diagnostic tools likely play a role. However, some experts suggest that environmental factors such as increased screen time and societal pressures might also be contributing to the trend. Regardless of the underlying causes, the growing prevalence of ADHD underscores the need for greater understanding, support, and access to effective treatments. Addressing this public health concern requires a multi-pronged approach that encompasses research, education, and destigmatization efforts. Section 5. The Dopamine Connection: Unraveling the Biology of ADHD. Research suggests that ADHD is rooted in differences in brain structure and function, particularly in areas related to attention, executive function, and reward processing. One key neurotransmitter implicated in ADHD is dopamine. Dopamine plays a crucial role in motivation, focus, and pleasure. In individuals with ADHD, the dopamine system may not function optimally. This can lead to difficulties with sustaining attention, regulating impulses, and experiencing motivation in the same way as neurotypical individuals. Imagine a car with a faulty gas pedal. Sometimes it's unresponsive, and other times it's too sensitive. This analogy can help illustrate the challenges of dopamine dysregulation in ADHD. Brain imaging studies have revealed structural and functional differences in the brains of individuals with ADHD compared to those without the condition. These differences are often observed in the prefrontal cortex, the area responsible for executive functions like planning, decision-making, and impulse control. Understanding these neurological underpinnings is crucial for developing targeted treatments and interventions. Section 6. Beyond medication, exploring the spectrum of ADHD treatments. While medication is often the first line of treatment for ADHD, it's not the only option. A comprehensive approach to managing ADHD typically involves a combination of interventions tailored to the individual's needs. These may include medication, therapy, lifestyle modifications, and assistive technologies. Medications for ADHD, such as stimulants and non-stimulants, work by modulating dopamine and norepinephrine levels in the brain, improving focus and reducing hyperactivity and impulsivity. Therapy, particularly cognitive behavioral therapy, or CBT, can equip individuals with coping mechanisms, organizational skills, and strategies for managing their symptoms. Lifestyle modifications, such as regular exercise, adequate sleep, and a balanced diet, can also play a significant role in managing ADHD symptoms. Emerging technologies such as neurofeedback and transcranial magnetic stimulation, or TMS, show promise as potential treatment options, but further research is needed. Section 7. The digital distractions, smartphones, and the fragmented mind. In today's digital age, our attention spans are constantly bombarded with notifications, updates, and endless streams of information. While smartphones and other devices offer convenience and connectivity, they can also exacerbate attention challenges, particularly for individuals with ADHD. The constant pings and buzzes of our devices trigger the release of dopamine, creating a feedback loop that can be difficult to resist. This constant state of digital distraction can fragment our attention, making it challenging to focus on tasks that require sustained effort. For individuals with ADHD who may already struggle with attention regulation, the allure of smartphones can be even more potent. It's essential to be mindful of our technology use and establish healthy boundaries to protect our focus and well-being. Section 8. Seeking professional guidance, navigating diagnosis and treatment. If you suspect you or your child may have ADHD, it's crucial to seek professional evaluation and guidance. A qualified healthcare provider can conduct a comprehensive assessment, considering your medical history, symptoms, and any potential co-occurring conditions. Diagnosis typically involves a combination of interviews, questionnaires, and behavioral observations. It's important to note that there is no single test for ADHD, and diagnosis is a clinical judgment based on a thorough evaluation. Once a diagnosis is made, your healthcare provider can work with you to develop an individualized treatment plan that addresses your specific needs and goals. This may involve a combination of medication, therapy, lifestyle modifications, and ongoing support. Section 9. Empowering focus, living well with ADHD. Living with ADHD can present unique challenges, but it's essential to remember that it doesn't have to define you. With the right support, strategies, and self-understanding, individuals with ADHD can thrive in all aspects of life. Embrace your strengths and recognize that ADHD often comes with its own set of advantages, such as creativity, out-of-the-box thinking, and a passion for pursuing interests. Connect with others who understand the ADHD experience, whether through support groups, online communities, or personal connections. Remember that seeking help is a sign of strength, not weakness. By advocating for your needs, embracing strategies that work for you, and fostering a positive mindset, you can navigate the challenges of ADHD and live a fulfilling and meaningful life.